Boy, what a historical moment this is. It's really a great reason for all of us to celebrate. I'm really excited because now our clinicians, our hospital staff can take care of the community without being so scared.
You know, I think that all of the healthcare workers and all of us, you know, that aren't in healthcare have been feeling really down. Some days I get home from work and I know that our nurses, our CNAs, everyone feels this way and just feels just really sad because we see the worst, the most devastating aspects of this disease.
I've just recently started working on the COVID unit. I've been down in the regular ICU taking care of the patients that's been coming in with other diagnoses. Today is day 3 on the COVID unit, and it's horrific to see it in person.
The patients are with us for quite some time, sometimes months, with a breathing tube, intubated, not able to talk, sedated, possibly paralyzed, not able to communicate with their families.
I mean, the way you help us is maintain your distance, wear your mask, and don't do anything crazy that'll get you infected. The stuff that you've heard over the last 9-10 months, right? And that can help us because right now, just under half of our people are COVID positive, maybe half our people. You know, it's just we're trying to find places to put them.
Realize that just because you see it on TV doesn't mean that it's not going to negatively affect you or somebody that you love. It's my sister. How would I get COVID from my sister? You can get COVID from anyone, from the grocery store, from your sister, from your grandmother. Just because you're outside does not mean that you don't have to wear your mask. You should still definitely wear your mask and social distance.
On the flip side, outside of COVID, I don't want people to stay away from my emergency room or our emergency room. If they're having chest pain, non-COVID things, don't doubt yourself, come in. We can protect you. We have 2 sides of the emergency room. That one's clean and one's COVID, and come in and get those things treated too. Don't wait till you're 4 days down the road with a heart attack or your asthma or your appendicitis or your headache. We got to take care of that too, because that'll hurt you just as worse than your COVID if you're not getting it dealt with.
I also want to remind everyone to stay vigilant. This is a sneaky, nasty virus and sometimes deadly. But it can be outsmarted.
I feel exhilarated. I feel like this day couldn't have come soon enough, and what an amazing scientific achievement that the world has done in creating this vaccine.
I was the 3rd person to get the shot today. I was very excited to do that.
I just had the vaccine and I feel great. It actually was less painful than a flu shot, so I wouldn't be afraid of it. I've read the literature on the vaccine. I feel it's very safe. And I would encourage everyone in our community to get it.
Just be patient. It's coming. Be patient. Do your social distancing. Wear your mask. But this shot will come out, and this will take care of so much of the problem.
Now that I've gotten the vaccine, I'm feeling hopeful for what the future is. Getting back to normal.
Today is and actually this week when I heard we were going to be getting the vaccine, is kind of the first time that I've woken up and felt like there's hope. Hope for all of us in the community. Hope that we can get this vaccine, see our loved ones, participate in the commerce, get our economy going, and get our businesses open. And like I said, it's not going to be in the next few months, but there is hope. And I can't tell you how exhilarating that feels.